Hello and welcome to the Interact Tracking Tool training session. This session will be about completing the Admitted with Recent Discharge Worksheet. My name is Dinah Buns and I'm a project coordinator here at Healthcare Quality Strategies Incorporated. In this session, we're going to review the worksheet instructions and we're going to learn how to enter data for residents admitted to your nursing facility. I'm going to pop out of PowerPoint and we're going to enter into the Excel sheet. This is the Admitted with Recent Discharge Worksheet. As in the other worksheets, directly below the title, you have a set of instructions as well as notes. The first item to make sure in this particular worksheet is that it does list today's date. And I am giving this presentation on March 28th. So that is the correct date. The reason you do want to verify that is because the transfers and the readmission rates are going to be automatically calculated for you based on today's date. Here it does give you instructions on the admissions that you should be entering in on this page. And the other item that you should pay attention to is this red asterisk. It notes in these different columns here in the blue bar which columns are required for the Excel document to work properly. You'll also notice that some of the columns here include the word automatic. These columns automatically pull the information for you or they automatically calculate it for you. So you do not need to enter anything there. Going back up to the white portion here, two more items that I want to draw your attention to. One is the line that you'll see highlighted in yellow, and that is for Watch These Residents. That means these patients have been recently discharged from a hospital. They are within that 30-day time frame, so they are considered at risk for rehospitalization. So be sure to pay attention to those residents. The other color that I want you to pay attention to is the red lines. These are residents that were readmitted to the hospital within 30 days. So Interact suggests that you perform a root cause analysis to determine what was the cause for their readmission. These colors will be automatically showing up in the worksheet. You do not need to highlight them yourself. Interact will automatically calculate that for you. If you have any further questions on which admissions you should record, I invite you to click on the link right here and it'll give you some additional information. I'm now going to enter in a little bit of information in this sheet. I'm going to scroll down since I have a listing of other patients here. And as you see, the colors change out, indicating that these patients in red, they had a readmission. And the patients here that are highlighted yellow, these are patients that are at risk of being readmitted. So I'm now going to click in the first column that I need to enter in information. That is the resident name. Again, Interact does give you some pop-up windows here to give you additional information. The first resident that I'm going to include is Mickey Mouse, and you can use this drop-down list here to select the correct resident. Go ahead and click on that. You can use arrow keys or tab keys to move along. In this column, you have to enter in the hospital discharge date. I'm going to enter in the 20th of March. Again, the tab over. And as you see, this row just changed over to yellow. That's because Interact realizes that this patient is at risk of being in that 30-day window and that it's alerting you that you should be watching out for this resident. Date admitted to the nursing home. Let's say that this patient didn't come directly to you. They came to you a few days later. Perhaps they went home first. Now you'll see when I tab over, it's going to automatically calculate the date. It already knows that the 24th was a Monday. In this field here, you're going to click on that drop-down menu, and you're going to select if this patient is a post-acute care patient or is a long-term care. In this case, Mickey Mouse is a chronic long-term care resident of ours. I'm going to select where this patient came from. This patient went home first, but you could select any of these options here. As you'll see, in this column here, it automatically assigns the hospital code for you. And we're going to go over to the last item here and enter in the insurance plan that they have. Mickey Mouse has the Eastern Advantage plan. We're going to scroll back and we're going to enter in another resident. In this case, we're going to enter in Mrs. Potts. I know Mrs. Potts is toward the bottom here. I'm going to scroll on over. Mrs. Potts came to us on the 27th of March. And let's pretend that I make a typo here, and I'm going to put in March 26th, 2014. When I try to move on, Excel is going to notify me, oops, date of hospital discharge must be completed first. So it's picking up that this doesn't make sense. You cannot be coming to the nursing facility before you were discharged. So in this case, I made a typo. I'm going to say, no, I don't want to continue. I do want to fix it. So I'm going to type in the correct date here, and that would be on the 27th. So Mrs. Potts was discharged and admitted on the same date. Again, Excel is going to automatically calculate the day of the week for us. Mrs. Potts, again, in this case, she was a chronic long-term care patient. She did come to us actually from Mountain Hospital. And the final item to put in here is, again, the insurance plan. Let's say Mrs. Potts has the Central HMO plan. That is how you enter in the data. The last item that I do want to draw your attention to is on the side here. On the side here, what you have are two tables. These are tables, this is called the Discharge from Hospital Dates table. It's a quick way for you to go back and make sure that you don't have any errors in your entries. You can go through and make sure that you don't see any numbers in months that haven't occurred yet to make sure you didn't make a typo, and also that you have the correct numbers in here. So it's just a very quick summary of the information that you've been entering, and it also automatically calculates over the course of the year where your discharges are coming from and which months you're getting them in. So right now we have a fairly even split that 1/3 are coming every single month, but this will change throughout the year. And there's a similar table for the admission dates as well. So use these two tables here all the way on the right-hand side to make sure that you're accurately entering your entries. So I'm going to scroll back up to the top and say that is how you enter in all the information here. I'm going to go back to my PowerPoint and say thank you for attending this session. My name is Dinah Bungs, and you can contact me at the listed phone number or the listed email. Thank you again.